everyone, welcome back to another episode of Voice of Care, Caring from the Heart. And today we'll be talking about something that matters to all of us, which is the heart, for the day that it starts beating. We have our esteemed guest today, which is Dr. Hameeth. So doctor, do you want to introduce yourself to the public?
Hi Shirley, thank you very much. Hi everyone, my name is Hameeth. I'm the consultant cardiologist and internal medicine specialist from Pantai Hospital Ipoh.
Alright, thank you doctor for the short and sweet introduction. So without further ado, let's go with the first question. So we all know that heart disease is the most common disease in Malaysia. So what exactly is the most common risk factor that causes it to become very common among us?
Well, it's a very good question, Shirley. Talking about heart disease in Malaysia, of course, everybody says that it's the number one killer, and they are right. When you talk about risk factor for heart diseases, you can divide it into two. I always tell my patient it can be modifiable and non-modifiable risk factor. When I say non-modifiable risk factor is your age, your sex, and your race. When you're getting older, it's something that we cannot modify that. So as we getting aged, the risk is getting higher. Number two is sex. Man is always at higher risk compared to female. And number three is race. Usually, certain races have higher preponderance, like Indian and Malays, compared to Chinese when it comes to ischemic heart diseases. That is for the non-modifiable. When we talk about modifiable risk factor, this is very important. Something that we can do to improve our health. First of all, diabetes.
That's also very common in Malaysians.
Diabetes. So I always tell my patient, first one is what? Diabetes. Second risk factor, doctor? Diabetes. Third risk factor, doctor? Diabetes.
No more diabetes.
No, the reason I'm telling that to patients is I want them to understand diabetic is the most important risk factor. Other than that is hypertension, high cholesterol, habits like smoking, sedentary lifestyle, eating at odd hours. People are obese with BMI which is high. These are all modifiable risk factor. The reason we say it's modifiable, we can control the diabetes.
Yeah, we can
control the hypertension. We can control the cholesterol level. We can control our eating habit. We can control our sedentary lifestyle. So it's all are very important.
Knowing all of these risk factors, right, we commonly associate them, like for example, diabetes with elder patients. But I think right now the landscape is a bit changing, where more and more younger adults are actually having heart diseases. So what are the reasons for this and how can we actually change this?
Important question, Shirley. When we talk about heart diseases in young, the spectrum of diabetes also have changed. Now, late 20s, people already getting diabetes. If you look at about 20 years ago, 30 years ago, probably people in 50s, 60s will be getting diabetic. But now, no, the trend have changed. For one of the major reasons why the young generations getting heart diseases, early age of them getting the diabetic, and the lifestyle. Smoking, new trend is vaping, all this unhealthy lifestyle and full of stress, they're all high stress, unable to manage this stress. These are also the reason why the young generations nowadays are getting these heart diseases.
What about the diet? I think recently our diet has already shifted to something oily at some point because it's also much more accessible, like fast food.
Majority of them going for fast food, which are processed food. If it is a fast food with a natural food, then it's different, but it's all processed food. So we talk about diabetic, we talk about eating habits. When it comes to eating habits, I would say late night eating.
Eating supper, mamak culture.
Supper is okay, but what do you eat during supper? Supper, you go to supper, you have a coffee without sugar, it's okay. But you go for supper, you take
roti canai.
You take nasi, roti canai, banji, like you are having in the lunch during lunch or dinner. That's the problem. Supper is not a problem. You can always sit down, chit-chatting, supper, fine. But what you eat during supper, that's what important, So if you ask my opinion, go for supper, no issue. That's the time that you have maybe release stress with your friends, chit-chatting. But don't eat like what you're having during lunchtime. Choose the right food, right amount. That's more important. And try to avoid processed food in our daily eating and also trans fat. When you look at it at the labels at the back, trans fat, if you see trans fat, avoid it.
When it comes to trans fat, usually what kind of food that we should avoid that are high in trans fat, like trying to reduce it?
Canned food, fast food, mostly these are all talking about trans fat. Natural like chicken, beef, bread, whatever, but the one that not canned food, usually okay. Most of this, all the trans fat comes from the canned food.
So meaning we should prioritize much more whole foods lah, less processed food.
Homemade.
Homemade food. Not only speaking of diet, how about in terms of exercising as well? Does it help in terms of managing heart diseases and all?
Very important. Exercise is very important. By right, you should be exercising 40 minutes a day every other day. Let's say if you say 40 minutes a day every other day, mean it's like 3 to 4 times a week, right? So don't take just the 30, 40 minutes every other day. Why don't we do it more?
More frequently.
Yeah, more frequently. We can do it every day. Why don't you do 40 minutes in the evening and 40 minutes at night? You get 1.5 hours, right? The more you exercise is good. Sometimes people say, Doctor, I have no time to exercise. How do I do? I say you change your lifestyle. For example, you go to Aeon for shopping. Exactly. Our habit is we park. If possible, we want to bring the car and park inside the door. Park the furthest you can. You start walking. You go anywhere. Anything less than 5 or 3 floors. Don't take the lift. Use the staircase. So my clinic is in the first floor. When patient comes to my clinic, first question I ask them, when you come to my clinic, just now you take your lift or you take the staircase? Then they know already I'm going to ask them that question. So I'm encouraging them to take the staircase. Maybe 10th floor, of course, you have to take the lift. But there are people, even at 10th floor, they're still using staircase. They are. Because they're so used to it. That's good. So start small. Don't straight away push that I want to take 5 floors, I want to walk on the staircase. Start small, do regularly. When it comes to exercise, I always tell my patients, do what you can, do the little one, but do it regularly.
Consistency is key.
Consistently. Don't do it for today. 5 days you don't do, then do it again. It's not like that.
So it's very important that even though sometimes, life gets in the way sometimes, but this kind of small habit actually can help us in the long run, right?
Things that we can do daily. We change our lifestyle, we tune our habit. Indirectly, you are doing a lot of exercises without even going to the gym or without even saying you are doing exercises actually.
Speaking of lifestyle as well, we always heard the saying that prevention is better than cure. So how does early screening, early detection helps us actually?
We want to prevent, right? Before we get the real disease. So prevention is always better than cure. My advice to the patient is, if you are above 30, those days I used to say 40, but now as the trend is going down, if you're above 30, go and see your general practitioners, go and see your regular GPs, talk to them, do a routine blood test and see if everything is okay. If the GP thinks that you are at high risk, then they will advise you to go maybe come and see me or any other cardiologist. Do a routine check like echo, stress test and ECG. If needed, then we can do CT coronary angiogram as well as a screening. From there, we can take it forward. Do we need further intervention or we stop it there and control the risk factors?
What does a CT angiogram does when it comes to screening?
Some patients, when they come with chest pain, echo, stress test could still be normal. It's a CT scan where we give a contrast. We specifically look at the heart muscles and heart vessels. It is a 3D image where we can see the vessels in the heart, whether there are blockages or not. Most of the time, we don't say how many percentage there's a blockage. We can tell you mild, moderate or severe. Then from there, we can move forward whether the patient needs to go for angiogram or not.
When it comes to heart diseases, right, does it come suddenly or are there actually signs and symptoms that people can look out for?
Yeah. Heart diseases, there are 2 types. One is massive attack, the one that just come like that. You were walking, you were doing some activity, suddenly there's a rupture of the plug and it causes sudden occlusion. That one we call it as myocardial infarction. There's a massive heart attack. Another one is where the blocks slowly build up within the muscle, within the plug over the years, to an extent where the blockage is more than 60-70%. You start to have symptoms. Means you walk a bit, you have pain. You do a bit of more additional extra activities, you have some discomfort or pain. Most people say, no, doctor, saya rasa angin. Saya rasa angin, saya rasa gastric. That is a mistake. Actually, that is an indicator telling them something is not right, go and get checked. You come, I check. If it is normal, then it's angin. Do whatever you want. Until you don't check, don't say this is angin. Check first.
Better check first, if not you will regret it. How about like people say when you feel like the left arm start to tingle?
Very, very good question. Many people comes to me and say, I have pain in my left arm. When they have this acute attack, when they have a chest pain, the pain will move to the left arm. The pain will move to the jaw. Not that left arm pain is a heart, but there are conditions like many people with a cervical problem, the neck problem. Any impingement on the nerve will cause hand numbness, hand pain. Mostly when hand alone pain is cervical related. But you have a chest discomfort and the pain move to the left arm, left jaw, back. that is different. If you have hand alone, 95% of the time it is neck related. Don't differentiate on your own.
Always go see doctor
see your
better.
doctors. Let the doctor decide. And most important, don't ask Uncle Google and Uncle ChatGPT, because you might not know what to filter. I'm not saying they are wrong. They have perfectly right, but they will give you too many infos and you wouldn't know which one to take. So go and see a doctor and they will filter it for you and they will decide what you need.
So in the end, always rely on your doctor for the much more better advice, because it's more personalized, right? And when it comes to personalization, what kind of advice that you would give to the viewers so that we can live a much more healthier lifestyle and trying to reduce the chances of heart diseases?
Dear viewers, we all love our heart. We want the heart to keep beating until the very last day. If possible, have a healthy lifestyle. Avoid sedentary lifestyle. Exercise regularly. If you do not have diabetes, try to avoid it as much as you can. Don't blame that my family all have, I'm genetic. No. Majority of it is on your own. Avoid it by better eating habit and good lifestyle. If you're already diabetic, it's okay. Control it well. See your doctor, get the treatment, follow their advice. If you control the modifiable risk factors that I told you earlier, everything will be fine.
In the end, everything starts with us and with small but consistent steps, I would say.
Yes.
So that's it for our podcast today, which is the heart, very important organ. So we should everyone, to our viewers, please take care of your lifestyle. So thank you, Doctor, as well, for being our guest on this podcast.
Thank you very much, Shelley. You're most welcome.
Make sure to follow, like, and subscribe to all of our social media, including TikTok, Facebook, Instagram, YouTube, or even LinkedIn, so that you won't miss out on our future podcasts. Alright, thank you.
Bye-bye.